Hi, my name is Karen Dubin, and I am a social worker and the Chief Operating Officer for Sweet Institute. And I am excited to start a conversation about social work power, which is what this video series is going to be all about. We're going to do this by taking one of the articles that we have started on this topic and reviewing a passage about it and then discuss it. And I'd love to hear your thoughts about it too. So please find the link to the article with this post and add a comment. And so what I'm going to do is I am going to share my screen so you're able to see the article and the passage of the article that I am going to be reading, and I'm also going to be commenting on as we talk about social work power. And all of this, by the way, is going to culminate in some additional things that we're going to be doing that are going to be all about social work power and all about the elevation and evolution of social work itself. So we're really excited to be starting this series. And on Wednesday, I'll also be posting some videos that are going to be just thoughts that I have that I'd love also to have comments from everybody about in terms of being a social worker, some of the things that comes up for us in that process, and the transformation of mental health. So this is the article, the role of social workers in the transformation of mental health. And I'm going to read the first several paragraphs and just have some comments about that. So here we go. The field of mental health has made remarkable strides in terms of research, interventions, and comprehension of various psychological conditions. The development of evidence-based therapies, medications, and innovative approaches has provided a solid foundation for treating mental health issues. However, despite these advancements, the translation of these achievements into tangible improvements in the lives of patients and clients remains challenging. Several factors contribute to this gap between progress and outcomes. One major challenge is the complexity and individuality of mental health conditions. Every person's experience is unique, and what works for one individual might not work for another. So I want to pause there for a second because, I worked prior to being in Sweet and prior to also having a private practice, for over 20 years, I did community mental health, and I did it with people living with serious mental illness who were also just as involved. And I think one of the biggest challenges that I did have is the design of treatment modalities to be for a particular ideal client. Knowing that there was no such thing as an ideal anything, right? But how, and that every individual that I had an interaction with was an individual who had individual interests and individual likes and individual needs. And that the systems of care didn't really address all of those things, certainly not in a way that was streamlined. The experiences that I had in organizing treatments and being able to get people connected felt often like this hodgepodge because there weren't programs or interventions that were really designed for an individual to be able to receive services close by where it is that they are or within the same organization or system. So it became a really, challenging process for me and for my client who was the one truly navigating these circumstances and struggling through, and then being deemed as not being successful in treatment because of some of these gaps that would occur. So, so it adds to additionally the stigma surrounding mental health. And so we're here right now. Additionally, the stigma surrounding mental health still exists in many societies, discouraging individuals from seeking help or adhering to treatment plans. And again, I think it's, there are different diagnoses and different substance use issues and different and when somebody is just as involved, there's a whole series of things that are barriers and get in the way of somebody actually accessing the care that they deserve to have, so that they can progress in their life. And one of our suite members uses this term all the time, the walking alongside your client. And so in those times when I'm walking alongside, the frustration that we both were feeling, although I wasn't living it in the same way that they were, but there was a frustration and experience oftentimes of helplessness and not being able to execute my role the way that I truly wanted to be able to ensure that the services that my client needed and their experience of themselves in terms of whatever their needs are, and including, their educational needs or their vocational needs, their spiritual needs, their financial needs, all of those things being things that we all need in order to be fully healthy and in recovery. So I'm going to leave it there. I'll be back next week on this topic to begin also continuing on and saying more about some of the experiences in social work and the experiences, that we have and with our clients. And I'd love to hear from you. So please post a chat below.